InnerQuest explores various pathways through which you can connect with the infinite wisdom of the universe and apply it to personal, professional, and spiritual growth. This program, featuring accomplished practitioners, educators, and authors, is provided by Infinity Foundation, an innovative center for holistic studies and research. We invite you to share this journey with us.
Hello, welcome to InnerQuest. My name is Jay Stone, your host for today, and our guest is Irit Revivo. Welcome, Irit. Let me tell our audience a little bit about you. Irit graduated from the Israel branch of the Pacific College of Oriental Medicine in 1995. Irit has a private practice focusing on acupuncture and Chinese herbology, foot reflexology, and other modalities such as dietary modifications and lifestyle counseling. She is a licensed acupuncturist in Illinois and national board certified in both acupuncture and Chinese herbology. Why were you drawn to Chinese medicine? In Israel, no less.
In Israel, right. My first encounter with Chinese medicine was in the late 1980s. My sister studied Chinese medicine. She just started. Nobody really knew much about it back then. I suffered from monthly migraine headaches from the age of 12 until the age of 19. She caught me in the middle of one of them and gave me one treatment, and I didn't have any more migraines for 9 months. We kept treating and they went away, and I was fascinated by the idea that you can heal so well without medications, without the use of chemicals. The needles don't have anything in them, they just stimulate the natural body healing. So I was really drawn to the field.
Is your sister still practicing?
She's still practicing. She just published her second book.
I wish you would have brought copies.
I know it's in Hebrew,
okay.
And that's why I didn't bring it. I'm actually working on proofreading the professional side of it in the translation to English.
Okay.
Yes.
And so how long have you been practicing?
I graduated in 1995, so that's about 22 years. I practiced before with reflexology, foot reflexology, and shiatsu, but acupuncture since then.
Were you practicing in the United States or in Israel with foot reflexology?
Good question, because my first course I ever took was in Los Angeles. I lived in Los Angeles for 1 year, and I took a Learning Tree University course of 3 months of reflexology. And I liked it so much that when I went back to Israel, I took a 2-year course in reflexology, and I started healing people through that. And
do you understand now what your sister did when she treated your severe migraine?
I do now. It's funny because I didn't understand then. All she did, she didn't even use needles. All she did was head shiatsu while I was getting the migraine. And you know, if you ever had migraines, you first have the aura and then the migraine comes. So she caught me at the point that I had the aura and the migraine never actually came, and then I had 9 months free of migraines.
And do you suffer from migraines?
I haven't had migraines in so many years I don't even remember. I remember because I go through them again and again while treating patients, because the first thing that brings you to acupuncture is very close to your heart. So if a patient comes with a migraine headache, I go through the process with them, so I remember how it was, but I don't suffer any kind of headaches anymore.
Okay. And how is the medicine you practice different than Western medicine?
Oriental medicine, Chinese medicine, acupuncture are holistic healing arts, and we look at the body as a whole. We diagnose according to the laws of nature, we call it, of the 5 elements and the 8 principles. The 5 elements being fire, earth, metal, water, and wood. The 8 principles being heat versus cold, dryness versus dampness and inflammation, inner versus outer, yin versus yang. And we diagnose and we see where did the person go out of balance, and we enhance those qualities and bring the body back to balance.
I know a little bit about the 5 elements as far as cooking, but there's some emotions and tastes associated with the five elements?
Every element, the elements can really describe any phenomenon in nature. So if you talk about tastes, every element has a taste that corresponds to it. So if we take the earth element, it's the sweet taste, and if we take the metal element, it's the spicy pungent, and the water will be the salty, and the wood will be the sour, and the fire element will be the bitter taste. So we ask all these questions in the first intake, and I ask you which taste do you like most, and then I see which element draws you more to it. You asked about another emotions.
Right. Like anger.
So anger would be more in the wood element, in the liver and gallbladder, and anxiety and overexcitement would be more in the fire element, and worry and overthinking would be in the earth element, and sadness and grief would be in the metal element, and fear would be in the water element.
There's organs associated with the elements.
There are organs associated with the elements. Just like I said, wood has the liver and gallbladder, and anger is associated with it. They really are there to describe any phenomenon in nature.
Well, the cycle of the seasons, summer, fall, winter.
That too. The earth element is the late summer, and I always go by their arrangement on the circles of the five elements. Yeah.
Well, because you grew up in Israel, which is a very different climate than we have here, has the five element theory helped you adapt your diet to this climate?
Yes. In the summer, when we have more heat, we want to we don't want to eat foods that are too hot, not to enhance the season too much. If in late summer, when we have the dampness, the air is very damp, we have enough dampness from the outside, we don't want to eat foods that create dampness on the inside, because then we would have an overload and we would have more dampness, more inflammation. So yes.
Thank you. Can you describe some of your successful cases that you've treated?
Yes, I mean I've had so many throughout the years, but I'm just thinking about one testimonial that I have on my website, and it's great. I remember when she came to me, she came with chronic fatigue syndrome, and chronic fatigue syndrome is really a diagnosis that they came up with to give a lot of people, especially women, answer and label, because they had so many different set of symptoms and without any syndrome.
Is that similar? Is it often tied into fibromyalgia?
Fibromyalgia is very close too. Yes, it's very close. And I treated a lot of fibromyalgia. Okay. Very successfully.
Please go on.
Okay.
You were talking about your successful cases, the testimonial.
Right. So she came with chronic fatigue syndrome. She was describing to me how she's sitting there looking at the microwave and thinking, I need to put this plate in the microwave, and I'm so tired I can't do that. And she wasn't sleeping well, and she was really low on energy, and she had joint pain. And when we started treating, she called me the ally on my journey. When we started treating her, first of all I told her, let's get rid of the labeling. Let's don't go on the websites and see what can go wrong. Let's just open one window, and the window to healing. And I helped her with foot reflexology and with herbs, and she completely changed her diet. Diet is a major part in acupuncture, and she went on to work in 16-hour shifts in a medical company, full recovery.
Yeah. Now, you mentioned foot reflexology, and I've seen foot reflexology charts where, like, the whole body, you want to say a little bit, let's say if somebody has a heart condition or a kidney condition, how you can work on their feet.
Yes, so we look at the feet as a map of the whole body.
Oh, you brought a book.
Yeah, I brought books for a few things.
Okay.
And if you look here, you see that the toes resemble the head area, and the ball of the foot resembles the chest, and the soft part and the arch resemble the abdomen, and then the pelvis and legs and feet. Also, this is the midline, so when the feet are put together, this is the midline, so the spine runs along the midline, and then the outer part of the foot represents the outline. This is in terms of just outer organs. You asked about the heart. Heart would be in the chest. Heart would be only on the left side of the body. So if we look at the feet, this is the left side of the body because I'm working on them this way. And the heart would be right here.
So you would access a point. Can you actually, when somebody has a heart condition, can you actually feel it in their foot?
Many times you can feel it in the foot. Many times I massage an area and they would say, "Are you working on my stomach? Because I'm feeling something in my stomach." A patient came last week for the first time, and she had Sion's, and she was all swollen here. The glands, the glands get very swollen. And I was working, and she said, "I'm really, really tingly here." And then later on, she said that the inflammation and the swelling was reduced significantly. So yes, people feel.
And so were you working on her feet or hands or both?
I was working on the feet.
Yeah.
Reflexology is feet and hands. I tend to work more on the feet, although the hands are great too.
Do you have your patients soak their feet before you work on them?
I don't, but I hear when you go to China, they first give you a foot bath and then reflexology. I really treat reflexology as a beginning of my acupuncture treatment, because reflexology is a treatment on its own. You can go for a 45-minute to an hour just treatment of reflexology. I first give foot reflexology, and then I go to acupuncture. I just make sure that all the channels are open. I relax the patient. They come from the outside world. I bring them into the room. When I get to the acupuncture part, they're much more receptive to the treatment. So that's how I treat the reflexology, and I get to treat 1 or 2 or 3 systems too.
Yeah. Now, I've known some acupuncturists or chiropractors that practice, and they also do a pulse diagnosis. Is that something you do as well?
We do pulse diagnosis and we do tongue diagnosis.
Can you elaborate on these diagnoses?
Yes. We have 12 positions in the pulse. We have 3 external and 3 internal on each wrist, so 12 positions. Each position reflects the state of an internal organ. So if we go, this is the left hand, the upper part would be the small intestine, and the deeper part would be the heart. And they are pairs in Chinese medicine, and they sit in the same element as well.
So you have to have a very sensitive touch, so you can gain information from your hands that the average person who doesn't have your experience or education
And some acupuncturists know the entry level, and some acupuncturists are masters in pulse reading. Everybody concentrates on other.
I remember hearing somebody who actually was from one of my teachers, how his teacher, a woman, came to see him, or one of the students there, he says, "Oh, congratulations, you're having a girl," and she didn't even know she was pregnant yet.
Right. We check that at the liver position of the pulse. That's also on the left side. And we do tongue diagnosis. The tongue also resembles the whole body. So we have the feet as a microcosmos.
And the tongue, there's different, the 5 elements in different areas of the tongue.
5 elements are there, and the different organs have representation on the tongue. And we look at the color of the tongue to see if we have heat or cold, if we have stagnation, if we have too much dampness, if the coat is too thick, we have too much dampness, if we have teeth marks. It tells us a lot about the digestive system. So yeah, we read a lot from the appearance, from face, from behavior, from the sound of the voice.
Vocal diagnosis.
Yes.
Okay. And what illnesses or injuries do you find the most challenging?
I would say nerve damage. Once the nerves have been involved, it takes longer to bring the person back. It happens, of course. It just takes longer.
We talking something like carpal
Numbness
tunnel?
or tingling. It could be carpal tunnel. It could be a neuroma on the foot. It could be sciatica. Any nerve pain. It's very intense for people, and it's very. It takes longer to treat.
And so the clients that come to you, are they often coming with a diagnosis already?
So I have a patient who came last week because we met in a yoga class. And he said, "I never tried acupuncture, I would like to try it." And I said, "Sure." He came to my office and he said, "I don't have anything to report. I mean, I'm healthy, everything is good." And I said, "You know what? I really appreciate that, because we like to enhance well-being. The tale is that a Chinese doctor, an old Chinese doctor in old China, would not agree to heal you if you came with a complaint. He would say you waited too long. So when you're healthy, to maintain balance, to maintain health, you come to an acupuncturist. Of course, today it doesn't really happen a lot. It happens sometimes, but most people come when they already have a problem.
Okay. Now, you brought a chart with. Would you like to talk a little bit about that chart?
Yes. A lot of things are reflected in this chart. You can see the muscle system. This is a motor point chart, but I really brought it to show the meridians. In Chinese medicine, we talk about qi. Qi is energy. It's the vital force. It is that animates life. Qi in the body, qi is everywhere, but qi in the body flows along very well-defined channels, lines, meridians.
Energy.
So I brought to show the meridians. Every internal organ has a meridian, a channel that circulates the energy of that qi. So for example, let's see if I can get up. For example, we can look at, let me see, this is the lung. Okay. We can look at the lung channel, and it starts in the chest. Here, it's here. It starts in the chest, lung 1, lung 2, goes all the way to lung 3, 4, 5, all the way to the thumb.
Okay, and so somebody has a lung problem, you can put an acupuncture needle in, let's say, in their thumb, and that's working the energy that's flowing up into the brain and through the lungs.
We have, if we talked about the 5 elements, one way of treating through acupuncture is treating through the 5 elements. So we have the 5 element points in every meridian. So if we talk about the lung, it always starts at the tip of the fingers or the tip of the toes. Lung 11 would be the wood point of the lung. And then lung 10 would be the fire point of the lung. And lung 9 would be the earth point. Earth point, also the yuan source point.
And so
of the
how
lung.
would you know,
So
would you put needles in all of those spots?
So
or
no, so that's what I was aiming to lung 9. So lung 9 is the yuan point, and it treats the lungs in chronic conditions. If it's a chronic condition of the lung, let's say asthma,
COPD.
or COPD, I would go more to a point like lung 9. If you came with the flu or a cold, I would go to a more superficial point, the luo connecting point of the lungs with the large intestine. It's per channel. So every point has very significant characteristics and addresses different issues.
Okay. Well, I think we're going to bring in someone named this is our camera person.
Hi,
Nice to meet you.
Kathy.
Kathy, okay.
And Kathy is often behind the camera.
I am.
And so why don't you talk to her, Irit?
Okay, Kathy, I want to introduce the Accutron.
Okay.
Accutron is a machine that we use to treat pain, to bring deep tissue healing to the body. I also use it to treat people who are afraid of needles. If little kids who come and I treat them for allergies or for any other issue, I treat them through the Accutron. I wanted to demonstrate if you have any area of pain today, you can show me and I can show how the Accutron works.
Okay, and I will mention that you did a little testing before the show.
I did a little testing.
And a little tryout, and Kathy said her pain was gone, and it was in about 10 or 15 seconds.
It was, yes.
And how long did you have that pain, Kathy?
Probably a while.
Yeah.
When a while, are we talking a week or?
Probably a couple weeks.
A couple of weeks. And that's why it went away so quickly, because if you came with pain that was there for months or years, we would have to work a little longer and you would have to come back for a few more times. But anything that that is new is very easy to heal, and that's why the Chinese doctor wouldn't treat you if you came too late. This Accutron also reflects color into the different areas and points of the body. So I was testing Kathy for to see which color makes her strongest. And the color that we found through muscle testing that made you strongest was the indigo color.
That's correct.
And is there any significance to the colors associated with any organ or chakra or meridian in the body?
Yes.
Okay.
We didn't talk about colors, but if we talk about blue, the blue and the blue family colors heal the water element, and the red more the fire, and green wood, and yellow earth, and white would be, so white would be no color, would be healing the metal element. So you went more to the family of the blues.
Okay.
And every color has many, many more characteristics of bringing harmony and bringing balance and moving stagnation. So okay, so I will show. First we wet. The only thing that touches you are wet Q-tips.
Okay.
So do you have any more pain or?
No, not
Okay.
here. And
So
I see
I
a
will
little
show
bit
as
over here,
if,
so.
do you
I
feel
think
it
it's from
here?
sleeping. Yeah.
Okay.
I don't
So
know.
so why don't you move your hair to the
Sure.
other side?
Okay.
So do
And
you
let
recommend
me-
she get a blue pillowcase?
Blue pillowcase, that'd be interesting. Okay, so I just go to the area of pain, and I circle
And
around.
I heard a noise. What's that noise telling you?
The noise tells me what program I'm working with. This one is Circle the Dragon. Another program can be creating polarity. So I can
So
show.
do you select a program that you want
I
to work?
select a program. Let me select a different program, and we'll create polarity. So far, they were biphasic. They were turning again here. They were turning around each other. Now we're creating polarity. One is south and one is north. The one with the knob, the button would be the north, and I can combine a point in the ear because the ear is another microcosmos of the big picture in the body. So if I go to the neck area in the ear, it would be right here. So the negative probe would be on the ear, and the positive probe would be on the point of pain. And I would just hold it for 30 seconds. And you see, you hear that there is a different sound. So now I know that I'm working
And
with a different.
would your patients normally be seated in a chair? Do they lie down?
Sometimes they sit, sometimes they lie down, and sometimes they stand because sometimes I want them to move. So let's say she came with a neck pain, and I would treat, and then I would say, please move your neck, walk around, move it, and tell me where. Increasing circulation
And increasing range of motion?
and increasing range of motion.
Okay.
Definitely. Many times I say, why don't you? They come with a shoulder issue, and I say, raise your hand, and they can raise it only this way as opposed to this way. So we treat, and then I tell them raise it again, and we see how the mobility increases as well. That's why I want them sometimes to stand or to sit, and then before they lie down. Many people just like to lie down. If it's lower back, I lay them down.
And would you want your clients just to relax as much as possible, I would assume?
Okay, thank
Oh,
you.
thank you so much.
I'm
And I
gonna
feel
sit
so
now.
much better. I feel so much better. Thank you.
Thank you. The acupuncture treatment is very relaxing. First, people come and we talk. I ask how your week was. What would you like to concentrate on? I ask about the different bodily systems. How is sleep, and how is bowel movement? How is digestion? How is urination? I want to know how everything is doing. Then I lay them down on a biomat, which is a mat paved with amethyst crystals, produces far infrared heat. There is an infrared lamp on top of them. You lie on a table.
And are patients wearing clothes?
They usually wear clothes, yeah.
Okay.
Unless I need to get to some areas, I can give them a blanket to cover. I have shorts, or they bring their own shorts, and we just lower whatever area we need. Usually they're wearing clothes.
And then the table that they're lying on, do you keep that like at a doctor's office, they have like a sheet of paper, and then the next.
So I have, it's very homey. I have sheets. I have 100% cotton sheets. They lie on the sheet. They're very warm. The light is dim. The very nice light music is playing.
So it must be relaxing for you.
I'm very relaxed when I do reflexology. So I do the reflexology, then I do the acupuncture. They lie down for about 20 minutes with the needle. They fall asleep or meditate, and it's a very pleasant treatment.
So how many minutes long is a typical treatment?
My treatments are fairly long because I like to chat with my patients first. I find that through chatting you get to really know the core of what's going on. So first we talk, and then I do the reflexology, and then I do the acupuncture.
The foot reflexology.
The foot reflexology.
Yeah, but are there other places in the body that we can do reflexology?
So reflexology is in the feet, in the hands, and sometimes in the ears.
Okay.
And in the ears, oftentimes I combine needles in the ears or little stickers with needles in them in the ears.
And some people can read the head.
The head is another map of the body that we have.
Yeah.
And we learn all that in acupuncture school, and everybody chooses what area of concentration they would like to take.
Now, what's unique? First of all, what do you call your clinic?
I call it Mayan Moon Clinic.
And why do you call that?
It was a suggestion of my ex-husband. I had my daughter. One of my daughters is Maya. The oldest one is Maya, and the younger one is Sahar. Sahar in Hebrew means moon. So Maya and moon, Mayan moon. It was just embracing the.
And
the
do you consider anything you're doing at your clinic unique, other than you're doing it, and you've got a great base of knowledge and experience?
I find that I provide something very special that many people are not able to provide, and it's being present and giving the people a lot of space. Many times you go to acupuncture, to the doctor, to the chiropractor, and there are many rooms going at the same time, and the attention is very divided. I decided that I want to be there, I want to be present, and I only see one patient at a time. So if we need to talk about diet, if they need to talk about their emotions, if we need to talk about something that's on their mind, I'm there.
Well,
they know I'm there.
The person's going to feel special, that, I got to go.
It's important,
Yeah.
In this day and age, it's really important to feel that someone is there for you and listens to you and cares about you. I really bring all of myself to the healing process.
Excellent. And we got 1 minute, and I know you're not going to finish this question in a minute, but try. Do you collaborate with Western medical practitioners? Why or why not?
I actually do. When I worked in Winnetka, I worked alongside an internist. He had 3 rooms, I had 2 rooms, and we always treated patients together. He referred to me, I referred to him. He was my doctor too. I was his acupuncturist. I worked with a group of doctors in Arlington Heights. There were 8 doctors, a chiropractor. I was there. And it's good. It's good to talk about the person from every angle and to know more insights.
And I got to give these doctors a lot of credit that they were open.
Very true. And usually it's because they experienced
appreciated the help.
Yes.
Yeah,
yes.
because doctors really want their patients to stay well.
Very
Getting
true.
the signal wrap up. For more information about Irit, Infinity Foundation, or InnerQuest Talk Show, stay tuned to the credits at the end. We wish you good health, good fortune. Irit, it's been an honor and a pleasure.
Pleasure.
Thank you.
For more information about this show, our guest, Infinity Foundation, or any of our other programs, please visit our website, infinityfoundation.org, or call us at 847-831-8828.